Hello and welcome to the Healthcare Leadership in Action podcast from the Faculty of Medical Leadership and Management. My name is Kirstin and I'm the Director of Research at FMLM. This second series is focused on postgraduate leadership development and assessment. It is sponsored by the Dinwoody Charitable Company as part of a project to improve leadership development and assessment for doctors in training. Hello and welcome to this episode of Healthcare Leadership in Action podcast. I'm Kirstin Armit, Director of Research at the Faculty of Medical Leadership and Management. Today we're talking about vertical and horizontal development, and I'm joined by Dr. Daljit Hothi, Pediatric Nephrologist and Director of Leadership Development at FMLM, Dr. Yvette Oade, Regional Medical Director from NHS England, North Eastern Yorkshire, and Dr. Jamie Smyth, Public Health Specialist Trainee, London Borough of Southwark. We're delighted to have you with us. Thank you very much for joining this morning. So can I start off first of all, because the concept of sort of horizontal and vertical development might not be something that's familiar to every one of our listeners. And Dal, could I come to you and can you explain to us a little bit about what is horizontal and vertical development and how does that apply to leadership development?
Thank you, Kirstin. So I think a simple way of looking at this is that horizontal development is gaining more knowledge, skills, concepts. It's trying to become more knowledgeable, if you like, whereas vertical development is really trying to gain and develop wisdom. So you're trying to improve the sophistication of your thinking. You're trying to see how you use that knowledge and apply that knowledge, understanding the nuances of your context, really trying to broaden your perspective, integrate differences. So you're starting to, if you like, transition from knowledge to wisdom, and sort of really navigating the context in which you're working.
Thanks, Dal. So could you give us perhaps a couple of examples of the ways in which people will develop their sort of knowledge and skills, do that horizontal development and give an example around vertical development as well, just to help people understand a little bit more about what that looks like in practice?
Yeah, I guess let's take a clinical scenario because that's something we may be familiar with. When we start in a specialty of medicine, we're really eager to learn about that specialty, if you like, the knowledge base of that particular disease or that particular care pathway. But as you start to get more comfortable and confident in the knowledge, you then also need to apply that knowledge in the care of patients. And when you're looking after patients, you have to really adapt and refine your practice and your knowledge to really meet the needs of individual patients. So you have to use some of that knowledge in a wise way, in a sophisticated way, to be able to adapt what you're going to do for each patient. So you're moving from knowing something to actually how do I use that knowledge to really do the right thing for individual patients. So how can I be wiser in my choice with each patient I'm looking after? I hope that makes sense.
Yes, it does. It sounds like there's something about experience there is really important, and naturally things change during the career path. But I'd really like to get some examples from our other people on the podcast about their own experiences around horizontal and vertical development and how beneficial those approaches were from your own career. So, Yvette, could I ask you to sort of share some insights into what you've done in terms of horizontal and vertical development?
Yeah, thank you, Kirstin. So I think when I was a trainee, there really weren't many leadership development programs for trainees, but I did take opportunities such as actually coordinating the rota and organising the way that we worked as colleagues. But then when I became a consultant, there were leadership programs and development programs. So I did go on some of those before I went into a formal leadership role. However, I think what those taught me was more about myself, gave me insights into what type of strengths I had, but also that actually I would be dealing with people who had completely different perspectives. So that when I went into a leadership role, I was more prepared for the people who would be followers and supportive, and equally those people who were probably going to take more work to convince about things that needed to change. So my experience started once I became a clinical director or clinical lead.
That's great. Thank you, Yvette. I think that's really interesting about what you say with regards to programs and how beneficial they were for generating that insight into self and awareness of others. But then the applications, became as you started to particularly step into sort of more sort of senior leadership roles. What about in terms of sort of vertical development then? What were the things that helped you building on that? I guess sort of develop some of the wisdom that Dal was describing before that's associated with vertical development.
Well, I think working with experienced colleagues who were not just other medics, so not turning entirely to other medics for advice, but the general manager that I worked with, the head of nursing that I worked with, were fantastic at supporting me into my leadership role. And together, I think we often talk about triumvirates, where you can bring together different skill sets and often different personality types as well. So a lot of that experience came from working with those colleagues, more than I had done perhaps in other clinical roles. But also, actually, you learn from some of the things that don't work well. Sometimes when you try to make a change and it's not a success.
Great, thank you. I think the vertical development literature talks a lot about the importance of colliding perspectives. Actually getting a range of different perspectives, and you've highlighted that in regards to working with other medical and non-medical colleagues and the importance of those different perspectives to how to approach tasks. That's great. Thank you very much. Jamie, what about yourself?
So I think, yeah, there's a few different kind of stages that I think all medical trainees go through that kind of push that kind of confrontation of horizontal versus vertical development. And I think, going from being a medical student to a foundation doctor, or junior middle grade trainee up to being a specialist registrar, I think at all of those kind of steps, just as a medic or a healthcare professional is beginning to kind of gain that breadth of horizontal knowledge where they're starting to feel comfortable in that role, they then take a next step up to the next training job where actually they gain responsibilities and duties that aren't necessarily to do with the theoretical knowledge that they've gained. And I think healthcare professionals in general are really good at identifying horizontal learning and development opportunities, because it comes to going on a course, reading that textbook, studying for the exam, and developing that, ticking off the box and achieving that next step in growth as a clinician. But I think the identification of those vertical development opportunities, like as Yvette has said, those aren't as readily identified or as available sometimes for trainees. Especially, when I was going through being a foundation trainee into an internal medical trainee, or an internal medical trainee into taking a job as an ST3 before I started public health medicine, that kind of transition of going from, okay, now I feel like I've done all my exams, I feel like I'm relatively confident on the clinical management of certain things, and now I'm taking an ST3 job where it's not just enough to be thinking about the patient in front of me, but actually I'm now responsible for the team of other doctors who I'm working with on out of hours shift. And now I have to think about how they're working with their patients and how I'm working with the managers who are phoning me to let me know about the pressures in the hospital, or how I'm working with other departments and other specialties, and that kind of whole organizational kind of approach to, rather than just who is the patient in front of me. And I think that is a big challenge for a lot of doctors, and I think that's a lot of fear what people think about becoming a role such as the medical registrar on call. As to how we kind of get over that, I think a lot of people just try and push through to get the experience and do the job. There've been a few changes in training pathways recently to try and make those steps easier. So the recent kind of changes to internal medical training, where IMT3 is now almost like a supervised registrar year, to try and give people that opportunity to develop and almost make mistakes in a more controlled environment while they do that vertical development. Because, yeah, as I said, I think the horizontal development is fairly well covered in the studying for the exams, doing the job, but actually the vertical development bit only comes from either doing the job that you're preparing for, as Yvette has said, or having people around you that help you to prepare for that, which, classically haven't always been possible in previous training models.
Thanks, Jamie. I mean, there's a few things I wanted to pick up from what you were just saying. And I guess the first one is there does tend to be that, tendency to gravitate to courses and programs as a way of sort of acquiring more knowledge when people are even going through those transitions. But what you're just describing there is, quite significant challenges and opportunities as well when people step into new roles, and their sort of, their scope of what they're actually having to contend with and the range of people that they're kind of interacting with gets quite a lot larger than what they've been used to sort of previously. So I guess given that people do tend to sort of rely on courses at various times, and we've heard from Yvette as well about actually the value of some of those courses. I think it might be helpful for listeners to know what should they be looking out for if they're going to do more in terms of horizontal development. What might be the things that they need to keep in mind when they're looking at particular courses and programs? So Dal, can I come to you for your thoughts?
Yeah, so I mean, I think the reality is that we all like knowledge. The currency of knowledge is something that from our patients all the way through to, I suppose, our board members, is something that people really trust and believe in, because it builds credibility, it builds trust. So we shouldn't minimize the fact that we need to be knowledgeable, and we do need courses that will help us to be knowledgeable. But at the same time, knowledge alone won't allow you to be a good practitioner, a practitioner of leadership or a practitioner of medicine. And so we do need encouragement in courses to translate that knowledge into good practice. And what I mean by good practice is, how does one translate and bend and flex your knowledge for the specific needs of either your context in the space of leadership or for your individual patients? And you need to have that bend and flex. And to be able to bend and flex, you need to utilize your thinking. You have to say, why did I need to make this decision as opposed to that decision? And it's the thinking of the why and how that's really important. And that's a vertical. And so you need courses where not only are they giving you knowledge, but they're giving you experiences where you can utilize, test, experiment with your knowledge in different contexts and see what works and doesn't work in different environments and different sort of contexts. And then utilize the wisdom, if you like, or the objectivity of your peers to say, actually, I really like that. That's how that resonated with me. Or I didn't like that as much. I don't think that was effective. And again, your peers are really useful to help broaden your perspective, your thinking, your wisdom, if you like. So I think you need courses that give you knowledge, courses that help you to translate the knowledge based on experiences and experimentation, but you also need your peers to help you broaden your perspective and shift your thinking.
Great. Thank you, Dal. That's really helpful. And Yvette, I mean, there's more than courses available, aren't there, to help with that reflective thinking that Dal is describing, and that there are other ways other than courses, obviously, to sort of utilize, test, and experiment. I just wondered if you could give us some of your reflections of things that you have done or that you've encouraged and supported others to do to develop their thinking and wisdom.
Yeah, I think we tend to go too quickly to thinking about courses and formal learning, but I think the opportunities to observe are underestimated, and perhaps sometimes people don't approach leaders to see if they could shadow them or observe, because they might be they might think that opportunity doesn't exist. But most leaders that I've worked with and myself, I'm very happy to have somebody observe or shadow me, and both in formal settings, such as whether it's a meeting and it might be a decision-making meeting, or whether that's about being one-to-one and having the opportunity to spend a day. We had a great program in Leeds where we did walk in your shoes, and trainees could spend a day with a general manager, but equally, if that happened, the general manager had to spend time shadowing a doctor in training as well. But there's also other things like being part of interview panels, taking part in serious incident investigations, whether that's as an observer or actually being part of the investigation team. I think those are really good opportunities, not just to see how that particular process works, but also how the feedback from those processes is interpreted by leaders, and that gives you some insight as to how leaders come to making decisions.
Thank you very much. I mean, I think that's a really good point about actually the observation and shadowing, and not assuming that things aren't available. It's a whole thing of don't ask, don't get. Really. So being very proactive, I guess, and asking for those opportunities.
Yeah.
Thank you. So Jamie, what about in your experience, and given that you're in a public health role, are there differences in terms of those sorts of opportunities, or is it similar? And what have you done?
I would say it's probably fairly similar. I think the challenge when you're going to these kind of opportunities, especially ones that I find in public health, is that it's such an alien environment compared to what I think clinicians who go into public health are used to. That a lot of the short-term goals are exchanged for long-term goals, the ways of working are different, and that sometimes the theoretical knowledge that you've spent years developing doesn't always necessarily feel immediately accurate. So there is almost this temptation to fill the void of confidence with attempts to grow horizontal knowledge. So I guess one of the main challenges there is actually vertical development takes a back seat. Because you feel like, okay, I've got to learn how to do this job. I've got to learn how to make sure that I look like I know what I'm doing, so that people don't think that I'm an imposter. Like, this imposter syndrome does definitely kick in for a lot of medics going into public health, and I think that definitely takes the focus off of the vertical development. Thankfully, following the opportunities I've had with the National Medical Director's Clinical Fellowship last year, where I was given the opportunity to have that kind of time to think about my own decision-making processes and why I think the way I think, that going into public health, I've been able to take that step back and recognize that push and that stress to want to learn more, to develop more horizontally in order to make up for that shortcoming, when in reality, actually, now I can take a step back and say, well, actually, this is an opportunity for me to think more broadly. So I think that's a big challenge. And I think for anyone going into those environments where things have changed a little bit, or they're taking on new responsibilities, recognizing that almost compulsion to try and learn more, actually, it might be better to take a step back and think, well, why do I feel that way? Why do I feel like I need to do that? Is there a better way that I can assimilate to this culture rather than just, opening a textbook and studying for hours? And I think for opportunities to develop that way, actually, those opportunities are probably more accessible in public health, because generally the pace is slightly different to clinical medicine, where everything is, if you make a mistake in clinical medicine, or everything is busy and stressful in clinical medicine, whenever things unfold over a matter of hours. So you don't necessarily have that time. And if in the current climate, managers and senior leaders are feeling stressed from lots of different angles, there is a possibility they might not be so open to being shadowed. But actually, public health has got such a breadth of experience and people from different career backgrounds, both clinical and non-clinical, that people generally have the space to allow people into meetings to shadow or to show people what their job is. I've been really lucky at Southwark, where the consultants have all been very approachable, and if I want to join in a meeting to see how that looks, or what the role of a consultant is like, or even what the role of the director of public health within the council is like, they've all been very approachable. So I think those opportunities are all readily available within public health. And it's such a broad church as well. You've got so many different opportunities within public health itself, both within health protection, health promotion, and healthcare public health, that, all of those different spheres, there are people to reach out to and learn, actually, what does that job do? Or how do people do that job? Which is probably more important for vertical development of, why do you do the job that you do? Why do you make decisions that you do? And what are the challenges in that? And everyone's been very kind of approachable and friendly and willing to share that information.
So thank you very much for that. So there is something in all of this about sort of time and the environment and the people that are around you really either being sort of enablers or perhaps sort of constraints on gaining that sort of development, whether that be horizontal or whether it be vertical. We hear a lot at the moment about the constraints of time, the pressures in the system, the financial restrictions, all of those sorts of things that will be affecting people's development in different ways. So I guess I'm interested in how all of you navigate that when you have experienced constraints in your own careers, or how you perhaps helped others overcome or provided advice on some of the constraints that they've faced that are affecting their development and sort of progression. So Dal, what about you?
I think for me, Kirstin, the culture of an organisation is probably at the heart of this. So is an organisation about performance, or is the organisation about learning? Because if it's only about performance, then everything has to be right the first time. And if we're in an organisation that's about learning, there's room for failure, or there's room for growth and mistakes. There's room to say, let's stretch people, give them opportunities that they're not ready for the job now, but they will evolve and grow into that role. Then that's a very different mindset. And I think that's the truth. So for me, that's got to be the heart of everything. Are we here to learn and grow? Or are we here to perform? And when you're sort of almost navigating your own career, we all hate being judged or judging ourselves for our lack of perfection, or lack of high standards, or lack of achieving. Especially doctors, we're a nightmare. That's probably one of our tribal sort of characteristics. So we don't always put ourselves forward for roles where you think, actually, I'm going to be really stretched. It's really uncomfortable. I've never done this before, and I'm likely to fail and fall flat on my face for a little while. That's really uncomfortable, but that's going to stretch you, and that's going to help you grow both horizontally and vertically, in truth. For others, as leaders, how much are we putting our junior members of staff forward to new opportunities, to new experiences, where they again can experience something different and also perhaps be stretched and learn something new? So I think the culture is one, but there's also that commitment for ourselves and commitment towards others to really expand their experiences and allowing people to grow rather than be ready-made for the job.
Yeah, I think that's a really important point of the distinction around what's happening at the moment, and organizations individuals sort of asking themselves, what is the culture that I want to have here? What do I want to create? Yvette, so what about yourself? What are the things that you've done during your career that have helped you deal with some of the constraints that you've faced? What's been helpful?
Well, I think one of the most important constraints that you face as a leader is knowing that you do need people to come through who are going to, to either succession plan for yourself or others. I mean, in clinical teams, people are very good at spotting who they would like as the next person they to come and join their team, perhaps a trainee who's reaching the end of their program. And would this be somebody we want to come and join us as a consultant? And people, as you know, will make sure there are opportunities for individuals. However, as Dal says, it's really important that as an organisation or as a service, you offer opportunities to everyone to help them meet their whole potential. So I think that having the right culture, remember, hospitals are huge places. There are many, many cultures within them. There may be an overriding culture that starts from the top, but there are loads of micro cultures in there. For me, I think it's always been about saying to people, you've got a long career ahead of you. What else would you like to do? Because you will find that it's might become a bit monotonous if you're doing the same clinic every week or the same ward rounds. So are you interested in research? Are you interested in education? Are you interested in quality improvement? And then trying to help them, connect them with the right people, but also direct them as the kind of experiences that might help them along their careers. And we do come across people early on in their careers who are very interested in medical leadership. And for those kind of people, you might want to point them towards a leadership fellow year, like Jamie has done. Or it may be that people have got other constraints. They've got small children and they don't have the time. And so you look for other smaller projects for them to be able to be involved in. But for me, I think there have been people that I have had to point out to them that they've got real leadership qualities. Actually, they've got followers. They may not always realize they have, but people who respect them and who want them to be part of a team. So sometimes it's just having that conversation with somebody and saying, you've got this, and we can give you some opportunities to develop it.
Thanks, Yvette. I quite like that. There's something in what you're saying that makes me think there's a mentoring role, isn't there, as a leader, whether or not you're in a direct line management, but there's something about mentoring and helping them do the job now, but also that career progression. And there's something about a coaching style, as you said, that open question about what would you like to do, what interests you, and exploring that with people and making those connections as a sponsor in some ways. So there's leaders' roles are quite sort of important in all of this. Thank you very much. So the purpose of this podcast is about how do we support sort of trainers, educators, supervisors, help sort of colleagues grow vertically, as well as horizontally in terms of their development, and particularly with a focus around leadership development. And I just wonder, Jamie, from your own experience of trainers and educators, supervisors that you've come into contact with during your career so far, what are the things that you've noted of people that has been particularly helpful in terms of your own development, both horizontally and vertically?
Yeah, fair. I think it's important to acknowledge first that there are lots of different types of trainers that some will be more focused on just helping people get through the ARCP, their annual review of competencies. And I think that comes down from the fact that trainers at the end of the day for medics are consultants who have all their other responsibilities and duties as well, who are, not immune to the stress just because that they're trainers. And sometimes the same things that stop anyone else from having that capacity to train and teach sometimes, means that all they have the time or the mental capacity to do is just do that, to make sure that, their trainees are safe, they're getting their outcomes, they're passing through the ARCPs. But the really great supervisors and educational supervisors that I've had have been ones who've been able to take that additional step, and instead of just saying, right, well, are you on track to meet your competencies this year to get signed off, they're able to actually take an extra step back and say, well, okay, so I can see from this case-based discussion that you did X and Y in this specific clinical scenario, and why do you think you did that, and actually invite that discussion about why you made the decisions. So and rather than just saying, oh, I can see that you follow the clinical algorithm, great, or I can see that you have the prerequisite horizontal development knowledge to be the next grade, fantastic, but actually, have you considered how you lead a team? Have you considered the fact that while you're on your on-calls, how do you delegate? How do you make sure that, if you're in an arrest situation and that, you have someone who's about to become the trainee that's just one grade behind you that's about to take your job in the next year, how are you using that difficult critical care scenario to teach at the same time as providing life-saving care? And I think those supervisors that really ask those more challenging questions and almost suggest that actually, it's not just enough to memorize a textbook and pass the exams, but actually to be a really good clinician, you need to take care of a team, you need to know how to lead, and you need to know how to train the people around you. I think those supervisors are the ones that have a really great impact on their trainees, and are the supervisors who aren't just the ones who get their trainees to pass their ARCP, but are the ones who get their trainees to become really great clinicians. And I think that's a really important development for supervisors. But obviously, as I say, it's entirely dependent on them having the mental space and the capacity to do that, which I think in the current health system and the challenges that it's facing, sometimes that is not always as readily available as it once was.
Thanks, Jamie. I mean, it struck me as you were talking there that there is a lot about in all of the examples that you gave about professionalism actually developing as a good sort of professional, and seeing it's not just about you here and now, it's also about actually how you're developing, how you're role modeling, how you're delegating, and sort of leading others, and sort of really setting people up. I think a little bit like what Yvette was alluding to is looking at the long-term view rather than just the here and now. This is about you as a professional and you as an individual developing and having a really interesting sort of career for yourself, but actually being a leader and developer of others. That's really helpful to have those insights. Thank you, Jamie. Dal, I guess one of the things that's come up in the research for our for this particular project that we've been involved in about sort of improving postgraduate leadership development and assessment has been a concern amongst sort of educators and trainers and supervisors about feeling that they need to be an expert in leadership development. And I just wondered what your view is in terms of do people need to be an expert to help people develop horizontally or vertically?
It's really interesting because in that use of the word expert, we're looking through the lens of knowledge again, aren't we? The horizontal part. And perhaps we need to be encouraging our supervisors to sort of take that stance of wisdom instead. And so use your wisdom, use your experience to help engage your trainees in an honest but supportive dialogue about perhaps where is your knowledge gaps. Then let's think about your thinking behind this experience. How are you making sense of the world, or how are you seeing the world, and how others might be seeing the world, and how do they two differ? Ask them to think about what might the different perspectives have been in the environment that you were just operating in, or in this experience you were describing to me. how are you relating to yourself and what was going on for you? And that's part of your wisdom. And then finally, how did you respond to different views or opposing views? So if you just use that very simple framework, you suddenly don't need the expertise. You're just almost engaging in a conversation about thinking, but broadening the thinking of your trainee, and perhaps parking the need for expertise and more knowledge.
Thanks, Dal. And I guess that sort of it's a learning experience then for the sort of supervisor or trainer as much as for the trainee themselves. And I guess that being open to learning all the time, even if it's from people that are sort of junior to you. Yvette, Jamie, would you like to offer any views on whether or not you think someone needs to be an expert to do this?
I don't think they need to be an expert in leadership, but ideally they would have networks. When just as Jamie has described, quickly probably recognizing who's going to be a really great supervisor or trainer for me in this post, and who's just going to get me through the next 6-12 months. I think our educational supervisors very quickly recognise trainees and hopefully engage with them at a level that they can say, right, this trainee's really keen to do more in this particular area. And in most, certainly hospitals, in my experience, the educational supervisors, who are mainly consultants, but many of them may be senior trainees or other non-medical practitioners nowadays, they have good networks. They know people in other departments. And they are able to connect trainees to experiences. And I think my experience was the more that the consultants saw us having clinical fellows, having trainees join us for shadowing or observing, actually they started to ask for more. So I think having good networks and recognizing the breadth of opportunities within the organization can be really helpful to supervisors. Then they don't need to be leadership experts.
Thank you very much, Yvette. Yeah, that's a really, really good point around networks. And I mean, Jamie was pointing before to the point in his experience at the moment, the value of a really good network of colleagues that are sort of supportive in enabling development in a variety of ways. We're nearly at the end of this podcast, so I wanted to ask each of you sort of a question around top tips. So what would be your top tip that you would like to give either doctors in training or those that are actually involved in education, training or supervision? So something for people to take away. Jamie?
I think the thing that I find really helpful is having mentors and having people around you that can feed into that extra element of development. And whether that's, I think a lot of medics are really good at, a lot of clinicians in general are very good at finding mentors and role models that are providing clinical support or clinical advice or education. But actually, when it comes to leadership development and vertical development and all of these things, I think we're not very good at finding that. And I think part of that might be maybe because we don't necessarily always recognize that aspect is a really important part of being a clinician. I think that's one of the really good things about having a group like the Faculty of Medical Leadership and Management working to try and increase that awareness that actually a good clinician and a good leader, the qualities very much overlap. So having a mentor that doesn't just teach you how to develop your clinical career, but actually helps you to develop as a leader, helping you to, as I said, with my examples with the educational supervisors, to take that step back and ask, why are you making the decisions you're making? What it is that's driving you? And I've benefited from some really good mentors over the years, some of whom I've met through the FMLM. So I think, the networking and the mentoring availability that comes from groups like the FMLM, I think, are really invaluable in helping to become a better leader and a better clinician through becoming a better leader.
Great. Thank you very much, Jamie. Thank you for the plug for FMLM. And we do have a mentoring scheme that's available to members. So if anyone's interested, then please do check that out. And Dal, what would be your top tip in regards to vertical and horizontal leadership development?
I think I'd like to say that horizontal development is in essence something you can do on your own. But I would suggest that people pace themselves and just remember that it will only take them part of the journey towards becoming more effective. But it is effectively something you can do on your own. Vertical development, on the other hand, requires a community, because you need to be able to gain different perspectives. You need to gain different insights. You need community to support that sort of expansion of your thinking. And so, gain a community, if you like, and don't marginalize the vertical, and try to do both, because that's really what's going to make you more effective.
Great. Thank you, Dal. And Yvette, final word from you, final top tip.
So my final top tip would be, don't be afraid to ask. Don't be afraid to ask leaders at all levels and of all professions to have opportunities to observe them, to shadow them, or have they got small tasks that you might be able to get involved with, where you will really gain experience of working with others and certainly understanding perspectives that leaders will take on certain issues. So yeah, don't be afraid to ask. People love to share their experiences and have somebody working with them.
Brilliant. Thank you very much, Yvette. I wouldn't be surprised if you get some people contacting you after this in that case. But just to say thank you very much for participating in this podcast today. It's been really interesting to hear all of your experiences and insights, and I really hope our listeners have enjoyed this as well. So thank you, and enjoy the rest of your day. Thank you for listening to the Healthcare Leadership in Action podcast. If you want to learn more about what we do at the Faculty of Medical Leadership and Management, check out our website on www.fmlm.ac.uk, or you can follow us on social media. We're on X at FMLM_UK, or you can find us on Facebook and LinkedIn. Thank you to the Dinwoody Charitable Company for sponsoring this project, and to our producer, Dr. Shareya Khan, and our advisor, Dr. Raquel Sim. We'll see you in the next episode.